All right, everyone. Welcome back to another episode of Let's Talk Teeth. Today we have Dr. Carlos Parra. Dr. Parra, if you don't mind, just kind of introducing yourself, telling us a little about your background, where you went to dental school at, what you're doing now, and we can kind of just go from there.
Yeah, hello guys. Thank you for having me in the podcast. It's been great. So I'm Carlos Parra. I'm originally from Barcelona, Spain, born and raised there. Went to dental school over there in Barcelona, and then graduated in 2009. Did 1 year part-time fellowship in Perio over there. Also, at the same time, was able to work. So for a couple of years, and then in 2012, I moved to Boston to do my residency at Tufts, and 3 years there. Great city, great school. I had a blast, learned a lot, and then in 2015, graduated and moved to Dallas, so to Texas A&M, where
Yeah.
I'm the program director over there. I've been over 4 years. I've been the Perio program director, and that's a little bit my background.
Awesome. Um, Interesting story. That's really cool that you kind of came over from Spain, and I'm sure you've like learned things in dental school there that was a little bit different over here, and kind of met in the middle with your education. What kind of led you towards the perio route in dental school?
Yeah. So I always I always was inclined a lot into the medical field. So before going to dental school, I was thinking maybe medicine. My father is a physician, so I always have been inclined on that field, more of the natural sciences, medicine type.
Sure.
I was debating what to do, and then one of my teachers in middle school told me about. I mean, just brought up the topic of dentistry, and went home, started thinking, talked to my parents, and eventually focused mostly on the dentistry part of it. And as I was going through dentistry, I still had in the back of my mind a little bit of the medical sort of thought process on how, or how
Right.
the overall body. And I think perio involves a little bit of that. Involves the
Yeah.
systemic health and also has some surgical parts, which I think resembles a little more medicine than maybe other parts of dentistry. So that
Sure.
was a little bit how I started thinking about perio. Also, some of the teachers in my school back in Barcelona, they had studied at Tufts in Boston, so that also was also a little bit of an influence to try to move to the US, right? So I saw, they had studied in the US, how good they were. They were always, they were very passionate. So that opened
Sure.
a little bit my mind to maybe try to go to the US, to Tufts, to Boston, to pursue periodontics. So that's a little bit how it all started. Yeah.
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 That's
That's
awesome.
awesome. That's a really unique story, especially coming from overseas. What kind of made you want to stay after your residency at Tufts? Was there any thought of maybe going back to Spain, or were you kind of set on sticking around in America at that point?
I mean, my first original plan was to go back to Spain. I mean, I didn't have, well, at the time I had a girlfriend back in Spain, but I mean, I didn't have any reason to either to go back or to stay in the US. But I was like, I'm from Spain. All my family, my friends are from Spain. All the people I knew that had studied in the US came back to Barcelona, to the
Yeah.
school, teaching my school back in Barcelona.
Hmm.
So I thought it was kind of the normal process. But then as I went through my residency at Tufts, I started also thinking about where it was a little bit, what would be easier to have like a career, where would it be easier, right? So I realized that a lot of my friends or my mentors that went back to Spain, a lot of them had family offices. They had already like a lineage of dentistry. Whereas for
Right.
me, I would have to start from scratch.
Yeah.
And I think it's a little easier to start from scratch in the US. Also, the loans, I mean, were a little higher
Oh,
in
yeah.
Killer,
US than
man.
in
Killer.
Spain. So I had the feeling that maybe going back to Spain, the patients itself wouldn't maybe appreciate the fact that I had studied in the US. Yeah, other dentists, colleagues, they would be like, oh, wow, cool, you went to the
Sure.
US. But patients, no. So maybe I wouldn't get that much value back
Mhm.
home from the patient's perspective, from the
Right.
from the career, from the economic point of view. So I said,
Sure.
let
Right.
me stay in the US, try to make a career here. Also, I wanted to spend a good amount of my time in academia. I
Right.
ended being full time currently, right? But at the time, at least I wanted to be like 50% part time in academia. So back in Spain or in Europe in general, it's very hard to make a living from academia. Whereas in the US, you could definitely you can. I'm the
Sure.
example, right? You can live as a full
Yeah.
time faculty, right? So that
Right.
was also something that I always thought about it, and I always had have the chance to going back to Spain whenever I wanted. So it's like, I'm gonna stay in the US or try to stay in the US, and I can always go back to Spain. Whereas if I decided to go back home just after finishing residency, coming to the US would have been a lot harder, right? So I just
Hmm.
decided to lengthen a little bit my stay in the US and see what happens. And it's been like 11 years so far.
Yeah.
Yeah.
Obviously, you like it
Man.
enough.
Yeah.
Yeah. Time flies. So you mentioned, you wanted to do at least 50% academia. What was the pull for that reason? A lot of people finish up residency and they swear up and down on going to private practice, but you, even with your story as unique as it is, also deciding to do academics, what kind of led you to that field?
Yeah, so I think a lot of the reason is part of it is, or part of it at least, is mentors. So you have some of your professors that you see how good and how much passion they have, and they are professors in academia. So you want to sort of resemble a little bit what they are doing, how they are giving back to the students.
Sure.
I always knew I wanted to have that in my life, in my professional life. Even when I was back in Spain, I graduated, as I said, 2009. For those 2.5 years, I was still in Spain before moving to the US. I did this part-time fellowship, but then I spent one day a week. I was going into the school and I was helping in research, and I was also teaching the pre-doc students. So always since I graduated from dental school, I had at least one day a week. I've been linked with academia, either teaching
Yeah.
or research. So I knew I wanted to keep that. And then once I was in at Tufts, the opportunity to come to teach at Texas A&M full time, which full time in our school in Texas A&M means 4 days a week, and then one day you can do private practice. So I think that was very appealing to me, and I that's what I chose to do.
Sure.
Yeah.
That's awesome. And it sounds like you had, just from listening to your story, some good mentors on the way to kind of guide you into the position you are today. I know right now you're at Texas A&M, so kind of leading into our next part of the discussion, what's typically your day to day look like at Texas A&M within the Perio department? Is it pretty diverse? Or are you doing, relatively the same thing each day? How does that look?
Yeah, so I started 2015, I moved junior faculty, so I was mostly teaching in pre-doc. Well,
Hmm.
all pre-doc basically. We cannot teach in grad unless you become a board certified periodontist, which at least it takes a year after you graduate
Hmm.
perio program, which
Sure.
could be more, but at least it's 1 year. So for that first year, I knew I was pre-doc mostly.
Right.
So I thought mostly pre-doc. At that point, I didn't have, when you're just new to the place, you don't have much research projects. You're at the bottom of the food
Yeah.
chain. So I was teaching pre-doc quite a bit. I was giving lectures also in pre-doc, mostly I was doing like teaching in the floor, which I think was great introduction to the teaching world, right? Then I became board certified periodontist, and then slowly I started transitioning a little more into grad, maybe one afternoon a week, 2 afternoons a week. So now I had the mixture of pre-doc, which is more bread and butter, more diagnostic workups,
Hmm.
non-surgical therapy, to maybe now transitioning to grad perio, which I was able to supervise some periodontal surgeries, implants, soft tissue grafting, regeneration procedures, which was a great combination. And slowly I kind of got a little more weight in grad, became the assistant program director, and finally, like around 4 years ago, I became the program director. So now the role is basically we have 9 residents, 3 per year, and I'm obviously the responsible for them, right?
Yeah.
So we have we have usually a few days a week that is like everyone's in the clinic. So Monday after 10 o'clock all the way through 5 p.m., except for the 1 hour break for lunch.
Hmm.
All the residents are in the clinic. So I'm mostly in the clinic that day. Wednesday afternoon, also, all the residents are in the clinic, and then Friday all day, all the residents are in the clinic. So these are the common clinic times. And then Tuesday and Thursday is where we have a little more variation. The first years, usually they have a little more of a classes, more didactic component.
Sure.
Mhm.
And then the second years have a little more in between. So they have some classes, they teach the pre-doc students a little bit, and then they have a little bit of clinic on Tuesday and Thursday. And then the third years, mostly they have clinic on Tuesday and Thursday. So the third years, mostly they have clinic every day of the week, except one session that they teach the pre-doc students. Then we have these two main blocks of classes, which is classic literature review, which
Sure.
we review classic articles of Perio, which all the residents are in the class. And then we have current literature review, which we review current articles. And again, all the residents are always in the class. So those two classes or seminars would be the common ones. And then, as I said, Tuesday, Thursday, there's a little bit of variation, which each class, first years go to take this class, the second years take this other class. So that's mostly the schedule.
Sure.
And I'm running between classic lead, I'm always there on Monday. Wednesday is a journal club, which is a current literature review. And then I'm in the clinic the rest of the sessions. Not all the sessions. I also have a couple of sessions for office hours to work on some research and then to work on admin stuff because there's a lot of admin
A
stuff to manage
lot, yeah.
all the residents and make sure everything and everyone is stays within the line. But yeah, I think we have a very balanced program.
For sure.
Quite clinical. They also have a session a week for research to spend time in because we have a combined Perio and a master's project. So they get the
Mhm.
Perio certificate and the Masters of Science. So they are required to do this master's project. So they have around one session a week to work on their project also, which could be a clinical project. So a couple of my residents are doing surgeries on that research
Yeah.
time, or
Right.
it
Yeah.
could be an in vitro or in vivo project. So one of the residents is doing some implants on a pig ribs. So he's placing implants on pig ribs and checking
Torque
the
values
the
and stuff.
torque of those
Torquing and all
implants.
that, yeah.
So that varies a little bit. So yeah,
Yeah.
that's mostly
Man.
the program.
Yeah, well, thank you for that pretty in-depth and pretty robust review of, your program. I feel like you kind of went through everything day to day as far as what the presidents are expected to do. I guess my question is, you've taken over for the past 4 years. As far as an applicant standpoint, what do you think stands out the most about A&M's Perio program in comparison to other programs in general?
Yeah, I think our program is quite appealing. We have a lot of applications, like around 200,
Oh my.
um,
Wow.
200-ish. Not all of them are completed. Maybe 150 are completed. So that those 150,
Yeah.
I have to review each of them. Me and another
Yeah.
faculty go through all of them, and it's always very hard. I mean, it's very appealing because I think, well, Texas in general, I think is a state that currently is attracting a lot of people. Then within Texas, I think Dallas also is a quite attractive city.
Hmm.
Then,
Hmm.
as I said, the program is we have the program since 1955, so it's quite a historic program. There's a couple of older programs, but it's a quite of a historic program. It's very clinical, which is also quite appealing for the applicants, at least the people that want
Yeah,
to dedicate
definitely.
their life practice mostly. And then also it's a state school, so it's relatively cheap, very cheap. The residents get a stipend, so they end breaking even. Tuition and stipend, it mostly breaks even. So that's also pretty appealing. The only thing is that we only accept three residents
Yeah.
per year, so it's very competitive. We go through the pass match system, so
Hmm.
everything is relatively standardized. As you may know, some of the problems problems on our side is that some of the schools, for example, they don't rank their students, right? I mean, rank is not the only parameter we look, but
Right.
it's important.
It's one
I
of them.
think
Sure.
we all think it's important. So some of the schools don't rank, so that could be. I
That gets
think
tricky, huh?
it's tricky.
Yeah.
It's tricky. And I think the ones that are harmed the most are the good students which are in those non-ranked schools, because then
Right.
they're in the same bucket
You know.
as the bad students, right? So
Yeah.
so yeah, if your school is ranked and you're a good student,
Sure.
that's in your favor. If it's not ranked, then you have to look at other parameters, right? Some schools may not rank, but they give honors or some sort of awards. So that's
Sure.
something that you can look, right? And then some people ask me, some applicants ask, what's the rank, how important it is. I mean, I would say it's not absolute. So I'd rather have someone that's 20% of their class, but is a team player, serious, and can work and is good, that rather than
Sure.
someone that's top 2% and then they don't really, they do their own thing, they
Right.
step on other people's feet, so
Sure.
so so
Sort of.
uh, I think it's not absolute, but definitely within equal candidate. I mean, in the end we see what we see the application, and if with within two equal candidates with two
Yeah.
equal research background, etc., obviously the one that has the highest rank has most likely more chances of getting into the program, or
Sure.
at least getting invited for an interview.
Right.
Hmm.
Then, well, on the interview, of course, then you have the human part, which is important, very important, and that's key, the interview. We usually bring 24 people for interviews,
Hmm.
so which is also really hard to select those 24. But I
Right.
think once you're within those 24, then the academics or more the written part of it takes a little second
Yeah.
paper, second, and then the interview part gets a little more force, right?
Yeah,
Yeah.
right.
That's
Yeah, I
awesome.
mean, ultimately, we want someone that, is ready to work hard, is a team player, and can follow the rules. I mean, the
Sure.
learning, I don't really care too much if someone already knows a lot about Perio versus someone that knows less. I mean, people will learn, and if you're willing to learn, they'll keep
Jumps
going
quick. Yeah.
improving, right? So that's the main thing. But again, it's very difficult to know exactly who's willing to learn, who's a team player, who's willing
Sure.
to follow the rules by what reading the CV or even interviewing them. A lot of people they rehearse the interview. You interview with them, and they seem like they're reading in their mind some sort of chat GPT, statement, right? So that's also something that we can sometimes notice, right? So
Right. Yeah, man, credit to you on keeping such a like organized and like fair process on like how you select your applicants. I feel like Saad and I could both agree that I think you value the right things. Obviously you want someone that's academically up to par, but also like somebody that you enjoy being around, that's eager to learn. And I think that it sounds like you do a great job of just selecting who you want to be a part of your program. I'm sure Saad is wondering the same thing, but as far as Texas A&M is concerned, what are your goals kind of for the future of the program? Like, do y'all focus more on like, let's say research or surgery? And do you see that in y'all's future? How do you see Texas A&M's Perio program kind of moving forward? Is there any new things you kind of want to incorporate?
yes, I mean, definitely. Excuse me. We want to get people out, get periodontists that are very, very competent, right? That they really are confident, and when someone really hires them, is like they're proud of hiring them, or when a patient goes to them, patients are happy with them, and so that will bring the name of Texas A&M, the school, high, right? But also I
Hmm.
think the way that the school gets more visibility is by research or lecturing in meetings, right? So for example, this Friday we have the Southwest Society of Perio meeting. So we're all the residents from the Southwest program. So we have all the Texas schools, we have Colorado, we have Nebraska schools, we have LSU. So we have all these residents. They come here to that is in Irving, which is like 25 minutes driving from Dallas, to give a lecture. And for example, it's important that the 30 years resident of each program present, right? So it's important that they show, and it's mostly cases. So it's important that
Right.
they show good cases, well planned and well executed cases, because that will bring the name within these schools of Texas A&M high further. Now, if you see a school that really does a good job, it's like, oh, wow, this school is good. So that would be one way. So presenting, having the residents out there or the alumni out there presenting and presenting good stuff. And then another stuff would be by publications, right? Doing research, putting our name out there. Ideally, we want to do more of a clinical research, like relevant research that's something that's applicable for daily practice. That would be the type of research we want to do. And now we just got actually a new chair, a new department head. Started like February 1st, so started like
Oh,
this week.
wow.
So
Yeah.
yeah, so he's basically my boss now. So he's gonna oversee the whole Perio department, and he's a senior guy. I mean, he's been out quite a while. He was a program director at Ohio State University for over 25 years.
Wow.
So I think he's gonna bring good stuff. He's kind of research heavy, but clinical research, which I think that's the final research.
Sure.
So we'll see what happens. But I think will want to bring also this part of clinical research out there, so the people will know a little more about our school and our program.
That's
Yeah,
all.
that's awesome. I mean, that's basically, and that's why Perio is such an interesting field. It's one of those places where you have to be constantly educated on the latest research. If there's a new bone grafting method or this new material, it's what you're going to end up using, and staying on top of that. That's what kind of helps lead you into the next generation of periodontics. So kudos to y'all for recognizing that and taking advantage of that. So that's cool. But I had another question about, just procedures in general. What kind of, is it just bread and butter perio, like a lot of soft tissue grafting implants? What's y'all's, do y'all have by the time you're graduating from Texas A&M Perio, is there a certain number that you're kind of expected to have, or is it just kind of depend on what walks in to clinic week to week?
Yeah, I mean that's a good question also, because I feel that sometimes some of the pre-doc students, they don't understand, or they don't know exactly what Perio does, because what they see is SRP, Profis, maintenance.
Those
So
Yeah.
RPs, man.
Oh man, you're speaking my language.
yeah, exactly. And we notice it many times with some of our pre-doc students. We have like a summer fellowship of 2 weeks, and some of them, they come to do the ones that are a little interested in peri, they come to this fellowship, which basically they observe in the clinic, they assist, and they come to the lectures. And a lot of them said that, that it opened their eyes, because they didn't know exactly what was, or what perio was, or what did we do, right? And I have also I have the same when I receive the interviews, when I receive the applicants.
Sure.
I know that there's some schools which I get a lot of applicants, and others I don't. For example, particularly, I'm going to promote a little my friend, UCSF, Alex Lin. He's a program director over there at Perio.
Yeah.
But I think he gets the pre-doc students very involved in Perio. So every year I get
They're
6 or 8
interested.
applications from UCSF, because
Wow.
I think over there, those dental students, they get to see what is Perio,
They
and then they
understand.
apply to all the programs, right? Whereas
Right.
maybe other schools, I barely get an applicant for Perio, right? So I think it's important to get the pre-doc students exposed, or at least be able to see what Perio is, right? Usually the residents, they we don't have hard limits, but we have some sort of unwritten expectations a little bit, right? Usually if they stay busy within their clinic time, they'll do more than what it's expected of from
Hmm.
them. Usually they can get any case that they comes to them, but it ends being mostly the most advanced cases go to the 30 years, the more basic to the first years. Also, I'm the one that distributes most of the referrals from pre-doc or other programs within the school will refer to Perio. So I'm the first person that receives the referral. So then I'll
Hmm.
assign, usually if it's crown lengthening, basic perio surgery, so a patient that has advanced perio that needs periodontal surgery, that will go also to the first years. If it's extraction, bone grafting, that will go also for the first years. Then if I see something a little more advanced, like soft tissue grafting or guided tissue regeneration for a vertical defect around the tooth,
Hmm.
that goes to the second years. Or if I see a referral maybe from AGV or PROS, which usually those cases are a little bigger, they're a little more complex, they have implants,
Hmm.
but if I
Right.
see a case that may take a little longer to be completed, I'll assign to a second year, because if I assign it to a third year, I know the case they won't be able to finish the case, so maybe
Right.
this case goes to a second year. If there's a case that maybe needs a lateral window sinus lift, or maybe a hybrid, so full mouth extractions, implant
Hmm.
placement, or a big guided bone regeneration to prepare the site for an implant in the future, that goes most for the 30 years. So those more or less are the distributions. But again, in maybe a first year, they get this perio patient, they have to do their perio surgeries, and then the patient needs soft tissue grafting, they can do the soft tissue grafting, or the patient needs an implant, they can do the implant. So if once they have the patient assigned, if they need more stuff, they can do the stuff. But I try to distribute the cases based on
That's fair.
difficulty. Regarding numbers, it's very dependent on the person, right? So and their interests. But usually it's relatively straightforward to get to 100 implants when you finish residency. Again, maybe there's someone that's a little less interested in implants,
And soft
and
tissue.
maybe they place 80 implants, but maybe they do a lot of soft tissue
Right.
graft. And maybe
Sure.
there's another one that's more interested in implants. They do 120 implants and a little less soft tissue grafting. We're
Sure.
very strong in IV sedation. So by state rules, you need to have at least 20 cases to get the IV license, right?
Sure.
So we get the residents do 80 to 100, 120 cases easily. So
Nice.
they're very prepared with all the IV sedation training, which is I think is important because IV sedation is, it's a serious thing that I think residents need to have a lot of experience, and I think they get that quite well in our
Yeah.
program.
Yeah. That's awesome, man. It sounds like I don't know a lot about every program, but it sounds like your program has a nice diversity of procedures, research, culture. It kind of sounds like y'all, from what I gather from everything you've told me, it sounds like y'all are pretty well rounded and y'all have good values in place on taking care of your residents too, which I appreciate, and I'm sure many other people appreciate. Kind of
Yeah.
backtracking a little bit on UCSF. I know you mentioned you get a lot of applicants there, and you're in a unique situation, man, because you're in Texas, so you're basically in your own country. So I know you got to take care of your own people too in Texas, which puts you in a unique situation for applicants in a way. How do you go about like, let's say you get an applicant from like, I don't know, I'm in the South, we're in Mississippi. So let's say you get one from like New Hampshire or something. Does that from a program director standpoint ever like pique your interest? Like, oh, I've never got an applicant from here. Let me look through their, file a little bit more and see kind of what they do. Yeah, I don't know, something along those lines. Is that something you value, like diversity within programs, or do y'all take a decent bit of Texas people only?
No, I think what I try to think is or look at the school, right? I mean, what's the reputation or how good is the school?
Sure.
That's important because there may be two schools with the same number of students, but the I don't know, like someone that's ranked 25 in one school is not the same as someone that's ranked 25 in another school, right? So
Right.
um, maybe the newer schools, I feel that they're a little weaker in the sense that the school hasn't been that long out there. Maybe
Sure.
and I'm not sure. I'm sure it's not all the cases, but I would say that some of the candidates maybe or the students are a little weaker maybe from those newer schools because many times you
Right.
rather go to a more classic school. You'd rather go to a Harvard than to one of the schools that has been out 5, 6 years only, right? Again,
Yeah.
Right.
it's not always the case. But I don't really think too much geographically wise. I think more like school,
I'm following
how
you.
is the school, what's the reputation. But ultimately, you have to look a little bit about everything. Regarding Texas A&M students, well, definitely we know them a little more, the people in Texas A&M. So that
Sure.
may give them an advantage because, ultimately, if you
Right.
know someone that's good already, they're good, you rather take the chance with them than with
Right.
Right.
someone that you don't know as well, right? So that
Understand.
just by the fact of being in Texas, not because they are in Texas, we want Texas people, but because they're in the same school that we
Uh-huh.
are,
It's just
uh,
familiar.
it's a little more familiar, right? If someone
Yeah.
comes from UT San Antonio or Houston, I don't know them, so I don't really care too much. They're kind of from this place or from New Hampshire, right? But the ones that from the own school, Texas A&M, it's a little easier to see how good they are, to know them, to talk to the faculty directly that have been teaching them. It's a little easier in that sense.
Yeah. Yeah, that makes perfect sense. And yeah, like you said, it goes down to a lot of factors, not just school and class rank, but also just how you interview and what you have researched. I mean, there's a lot of factors to it. So I know that's not an easy decision, but it seems like, for the past 4 years and based off what you were saying with, just the procedures y'all do, it seems like a very, very robust program that will leave you plenty prepared to be a periodontist, whether you want to pursue academics, private practice, or whatever. So as we kind of wrap up here, do you have any just kind of final advice for maybe a dental student who's maybe interested in perio or getting ready to apply to Perio. Just let's do three different situations. Dental student who's just started D1, D2 who's thinking about Perio, and a D3 who's getting ready to apply. Do you have kind of advice for each of those?
Yeah, I mean, the D1 is so D1 is thinking about Perio, but it's in D1, right? That's the first case
Yeah,
scenario.
right.
Yeah. Yeah, I mean, definitely you want to be academically strong, but I think at D1 you still have some, I think you shouldn't maybe close yourself to only Perio. If you're, I mean, if you know you want to do Perio 100%, yeah, go for it. Start talking to the Perio people. See if you can get involved in some research projects with some of the residents, or just show up. I think that'd be good. But I think at D1 still there's time to observe other fields if you're unsure.
Hmm.
It's not going to make a big difference. I don't think we get a lot of D1s interested in Perio, and it's not a problem. Or we may
Yeah,
get, but I don't see them. I don't know about them. They don't go in the clinic. Mostly they have classes, right? So D1 is
yeah.
still, if you like Perio, it's good to show up, but it's not that critical. Definitely at D1 I would focus on your academics, on starting creating the foundation. I think D2 is when you can start a little bit more heading into talking to Perio people, and if you can get involved in a project, in a research project that, with someone in Perio, I think that would be great. And then D3 also, you can maybe shadow some of the faculty, even go to their practices every now and then. They get to know you. Go to the local Perio meetings where the residents or Perio faculty may attend. I think that's good. But there's a fine line also. You don't want to overwhelm the people, or
Right.
sometimes people try so hard that they become a little annoying, quote unquote, right? So I
Hmm.
think just be natural and do what you like. If you really like Perio, go to the meetings, talk about Perio, do
Sure.
all that. But I would say don't fake it, or don't overdo it, or don't fake it to do it in excess, pretending or thinking that's gonna help you, because I don't think so. I think it has to come out naturally from
Right.
each person. I think that also that's mostly when someone is in residency. But I think that the most important thing is each person. So the thing of residency is that there's a lot more freedom, in the sense that we live is a little more open-minded. So people have to read on their own. They have to start creating their own opinions on their own. So I think in dental school, everything is more like delineated.
Structured.
You have to do
Sure.
this, and this is
Yeah,
this because this.
standardized.
And that's how it is.
Yeah.
And no, don't do this because it doesn't work. Or no, you have to
Hmm.
do it this way because it's like this. But in peri residency, I think it's like, oh, what do you want to do it? Oh, why you want to do it this way? Okay, I agree. Let's do it this way. Or I think it's a little more freedom of mind, but that's a double-edged sword. If you are a very driven person, that you're willing to learn, you're willing to read, you're willing to get to try things, to discuss things, and then just to think is very good, because then you can keep learning, keep enhancing a lot. But if you're a person that really is laid back, that is waiting that they would spoon feed them, then it's going to be bad residency. You won't
Good
learn
luck.
as much. So,
Yeah.
so I've seen both sort of examples. You have people that are very driven, they are like all in and they work really hard. So those the experience that they get and the amount of information and period that they learn is up here. Whereas someone on
Sure.
their same class, same classes, they have the same faculty, they have the same clinic time, but they just stay down, right? So
Hmm.
I've seen that. And so it's down to the person to
Yes, sir.
learn. You can be in the best program with the best faculty, but if you just don't want to learn, if you're late to class, if you're just trying to cut corners, you won't learn as much. And someone maybe in a program which is a little weaker, maybe there's less faculty, maybe there's less reputation, but if they really like it, they're
Sure.
go-getters, they will learn a lot more, right? So I think that's something that people need to have in mind.
For sure.
Yeah.
Dr. Parra, we have 50 seconds left here, but Sadna, I want to thank you very much for taking your time this evening to talk about you, your program, and your journey, and how you contribute to the field. We really appreciate it, and we think that our listeners will get a lot from this podcast. 30 seconds left. Last and most important question, arguably, FC Barcelona or Real Madrid?
Well, thank you guys for having me. The answer is tricky because, as I said, I am from Barcelona, but I go for Real Madrid. So
Oh my
that's
goodness.
No.
Crazy.
Oh,
Man,
in the podcast, in the podcast.
Are,
yeah,
are you guys Barca Madrid or what?
Barca.
Barca, yeah,
Peace out,
Awesome.
man,
Dr.
we were
Parra.
so
Totally perfect.
close.
We
Yeah.
enjoyed it.